So, what is sickle cell anemia? Well, according to mayoclinic.org, sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, the flexible round red blood cells move easily through blood vessels. In sickle cell anemia, the red blood cells are shaped like sickles or crescent moons. These rigid, sticky cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. There's no cure for most people with sickle cell anemia, but treatments can relieve pain and help prevent complications associated with the disease. Symptoms. Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time. Signs and symptoms may include anemia. Sickle cells break apart easily and die, leaving with too few red blood cells. Red blood cells usually live for about 120 days before they need to be replaced, but sickle cells usually die in 10 to 20 days, leaving a shortage of red blood cells. Anemia. Without enough red blood cells, your body can't get enough oxygen, causing fatigue. Episodes of pain. Periodic episodes of pain called pain crises are a major symptom of sickle cell anemia. Pain develops when a sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joints. Pain can also occur in your bones. The pain varies in intensity and can last for a few hours to a few weeks. Some people only have a few pain crises a year. Others have a dozen or more pain crises a year. A severe pain crisis requires a hospital stay for some. Some adolescents, when I say for some, I mean some people can treat it at home with medication, pain medication, and some would have to go to the hospital because the pain medication isn't working. Some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bone and joint damage, ulcers, and other causes. Swelling of hands and feet. The swelling is caused by sickle-shaped red blood cells, blocking blood flow to the hands and feet. Frequent infections. If y'all see me sweating, which I am, that's because the fans are off, because I'm trying to make this audio as high quality as possible. So bear with me as bear with me in this heat, please. Another symptom includes frequent infections. Sickle cells can damage your spleen, leaving you more vulnerable to infections. Doctors commonly give infants and children with sickle cell anemia vaccinations and antibiotics to prevent potentially life-threatening infections such as pneumonia. Delayed growth of puberty. Red blood cells provide your body with the oxygen and nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and children and delay puberty in teenagers. Vision problems. Tiny blood vessels that supply your eyes can become plugged with sickle cells. This can damage the retina, the portion of the eye that processes visual images, and lead to vision problems. Causes. Sickle cell anemia is caused by a mutation in the gene that tells your body to make the iron-rich compound that makes blood red and enables red blood cells to carry oxygen from your lungs throughout your body, hemoglobin. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become rigid, sticky, and misshapen. Both mother and father must pass a defective form of the gene for a child to be affected. If only one parent passes the sickle cell gene to the child will have the sickle cell trait. With one normal hemoglobin gene and one defective form of the gene, people with the sickle cell trait make both normal hemoglobin and sickle cell hemoglobin. Their blood might contain some sickle cells, but they generally don't have symptoms. They're carriers of the disease, however, which means they can pass the gene to their children. Risk factors. For a baby to be born with sickle cell anemia, both parents must carry a sickle cell gene. In the United States, sickle cell anemia most commonly affects black people. Complications. Sickle cell anemia can lead to a host of complications including stroke. Sickle cells can block blood flow to an area of your brain. Signs of stroke include seizures, weaknesses, or numbness of your arms and legs, sudden speech difficulties, and loss of consciousness. If your child has any of these symptoms and signs, seek medical treatment immediately. A stroke can be fatal. Acute chest syndrome, which is what I had before. A lung infection or sickle cells blocking blood vessels in your lungs can cause this life-threatening complication, resulting in chest pain, fever, and difficulty breathing. It might require emergency medical treatment, and boy did it. Yes, it did. They had an IV in my neck. I could taste all the medicine coming in my body. Pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. Shortness of breath and fatigue are common symptoms of this condition, which can be fatal. Organ damage. Sickle cells that block blood flow to organs deprive the affected organs of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen. This lack of oxygen-rich blood can damage nerves and organs, including your kidneys, liver, and spleen, and can be fatal. Blindness. Sickle cells can block tiny blood vessels that supply your eyes. Over time, this can damage your eye and lead to blindness. Leg ulcers. Sickle cell anemia can cause open sores on your legs. Gallstones, which is what I had. The breakdown of red blood cells produces a substance called what? Bilirubin. A high level of bilirubin in your body can lead to gallstones. One second. Excuse me, that was a plane fire. Yes, like I was saying, gallstones. The breakdown of red blood cells produces a substance called bilirubin. I hope I'm pronouncing that right. A high level of bilirubin in your body can lead to gallstones, which will then lead to a gallbladder removal, which I had. And that pain, oh my lord, that pain. That's a different kind of pain, too. Priapism. Priapism. In this condition, men with sickle cell anemia can have painful, long-lasting erections. Oh, interesting. Sickle cells can block the blood vessels in the penis, which can lead to impotence over time. Pregnancy complications. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having low birth weight babies. Prevention. If you carry the sickle cell trait, seeing a genetic counselor before trying to conceive can help you understand your risk of having a child with sickle cell anemia. They can also explain possible treatments, preventative measures, and reproductive options. And with all that being said, don't pity me.